When watching the gymnastics video, I noticed that a fitness component which was a strength was her flexibility. This is because she reached 180-degree splits in her split change. This was due to her increased resting elasticity and greater range of movement at the hip joint. This is good because it decreases the risk of injury and increases posture. Another strength was cardiovascular endurance. This is because throughout the whole of the floor routine, she lasted without tiring. I could tell this because she wasn't that out of breath and her skills stayed consistent. This would lead to cardiac hypertrophy and increased stroke volume and increased red blood cell production. A weakness was her balance. This is because in her double spin, she dropped her shoulder, which caused her to lose balance and then couldn't regain it, so she fell out of it. Her centre of mass was affected because she was up on her toe, which made her higher, causing her to be more unstable. She was also on one foot, making her more unstable, and because she dropped her shoulder in the spin, her line of gravity went outside her centre of mass, causing her to be more unstable. Another weakness was her speed. I could tell this because she didn't run fast into her tumbles, which had a detrimental effect on them. This was because she didn't combine strength and speed, which creates power. This caused her somersaults to be low and lack rotation. This could be because of her lack of PC stores. She could use creatine supplements to enhance her PC stores, which would increase speed. It also could be because she may be a type 1 muscle fibre. A strength of the tactic component was spatial awareness. This is because she knew where she was throughout the whole of the floor routine and knew where the line was that she couldn't go out. If she was to go out of the line outside the floor, she would lose a 0.1 deduction. This was because she could have a narrow attentional field as she only focused on one or few stimuli, meaning that she can block out the crowd and other distractions. Another strength was that she linked moves well together, such as tumbles and her leaps, and they flowed well together. A weakness was she had poor performance. This is because she lacked dance and creativity as she only moved her arms. This could be due to negative attributions. To change this, she could use attribution retraining to maximise motivation. The component which it could be was effort, to change as it is internal, stable, which gives personal responsibility and which increases motivation, confidence and future expectation of success. A skill which I noticed was a weakness was, a strength was her flicks, as they were consistent throughout. After her round-off, her arms stayed in front of her, which allowed her to pull them back quickly for her flick, which created power. Her legs are slightly bent on the landing of her round-off, however not too bent, as it would have slowed the flick down. Her legs extended quickly from the floor into her flick and straightened, and she looked back for the floor and pushed her hips up, so she was slightly arched. Once her hands were on the floor, her shape changed from an arch to a dish, so she could snap her chest up, which is known as the donkey kick. The ATP PC system was used as its low duration and high intensity. This is good as it has no fatiguing byproducts and no oxygen is needed. However, a skill which was a weakness was her somersaults. This is because she didn't stop her arms in front of her, known as a block, but they continued past her head, causing her to arch. Once she had taken off, she continued to arch as she threw her head back. This could lead to negative subjective outcome, which leads to decreased trait sports confidence, competitive orientation. This would then lead to decreased state sports confidence, self-efficacy and approach behaviour. The action plan that I would do manage gymnastics, as she is an autonomous performer, as she had high levels of fluency throughout the floor routine. The weakness which I'll be focused on is her tuck back somersault, which is a closed skill as it is not affected by the environment. It's also self-paced as the performer controls the timing of the skill. Low organisation as subroutines are easily separated, and a growth skill as large muscle movements are involved. I'll do a pre-test video analysis to analyse the head position throughout the somersault. Coaching points which I picked out are to keep the chin on the chest on takeoff to prevent her from arching, tighter tuck in the somersault to allow her to rotate faster. Don't lean too far back on the takeoff as it makes her go back instead of up in the somersault. A preparation which I would do is, which I picked out, is her round off flick tuck back. The round off flick tuck back is the flick. Landing of the flick determines what the somersault will be like. The landing of the flick needs to be with them slightly leaning forwards, so she can go up instead of backwards. This would mean that her hips would be extended. The execution stage would be the tuck back, which should have to ensure that her chin stayed on her chest. At this stage, she would have flexion at the hips. The recovery stage would be the landing of the tuck back. To ensure she would land it, she needs to open out, which is slowly straightening her legs, which is slow the somersault down, and she'll be able to spot the floor to be able to land. The session plan that I have made, I would make sure she does 5 round off flick tuck backs at the beginning of the session so I could assess her technique. At this stage I realised that her round off flick was the problem, as out of her flick she comes up very slow, leaving her hands on the floor too long. At the end of the plans I will also watch 5 round off flick tuck backs to assess the technique and see if it has improved. I would like to improve to 80% success rate. On week 1 I would use verbal and visual guidance. Verbal would be explaining, showing her where to put her arms, etc., and visual will be using demonstrations to aid the learning. To start off with, I would do round off over an object to make sure the chest is coming at fast enough. Once she has done 5 of these completed, not knocking over the object, it shows that her chest is going at fast enough. After this, I would move on to the flick, which I could also see as a problem. As well as, just like her round off, her chest is coming up too slowly. So in the flick, we would do the second stage of the flick, which is known as a donkey kick. So it's helping her to get her chest up. On week 2, I'll use visual and manual guidance, which is using demonstrations and supporting them, which to increase the confidence of the gymnast. To start off with, we'd pile up 4 to 5 safety mats and do round off flick, jump to shoulder stand. This stops her throwing her head back and stops her from arching over the top. Once she has completed 5 of these successfully, we'll take away 2 of the safety mats and do a round off flick, tuck back onto the mat. So this is much harder than doing it onto the floor or the tumble track, as it is higher and makes her push her hips up more on her takeoff. To start off with, the gymnast will be supported to stop her throw her head back and arching. If she does complete these successfully, she can do some on her own. However, if she is not landing them, it could be because she's not pushing her hips up enough on takeoff. Week 3 of the session plan, I would use manual guidance to help to support the gymnast for the shoulder stand, and visual guidance for using demonstrations. Before it is essential that I take away manual guidance before the end of the session to stop over-reliance. As in week 2, we'll do the round off flick jump to shoulder stand, however not onto the pile of crash mats this time. The coach will be stopping the gymnast and catching them. This helps the gymnast to keep the correct shape throughout and allows them to get used to landing on a harder surface of the floor or the tumble track. If these are performed well, the gymnast can then try a round off flick tuck back. However, if these go back to an arching over and throwing the head back, we can go back to what we did in week 2 and go back onto the crash mats. I could use positive reinforcement to strengthen the SR bond. At the end of the session plan, I'll do the post test to watch the 5 round of flick tuck backs again to see if her technique has changed throughout the somersault. Psychological aspects are that I could see that she was an introvert personality due to her poor performance on the floor. She would be type B of Durando's theory, as she was unambitious throughout her floor routine. Attribution retraining could be used to maximise motivation, which we could try and change effort, as it is an internal stable component. If she does change, it is down to her personal responsibility, which increases confidence, motivation and future expectation of success. Socio-cultural factors are starting off gymnastics, they could do it in PE lessons, which is at the foundation level in the pyramid. At this point, if they start to enjoy gymnastics, they could attend their local gymnastics club where they will be at the participation section. When they begin gymnastics at a gym club, they will be at the recreational squad, where they can train 1 to 2 times a week for an hour and a half. If any coaches within the rec squad think that they are talented, they may be asked to attend a squad trial, which can last between one session and 3 months. This is so they can monitor the progress of the gymnast and see if she is able to stay in the competition squad. The first competition they will compete in is grades, where it's split into compulsory and regional grades. Compulsory grades allows them to go to national finals, where they will be at the performance level of the pyramid. And also then other competitions they are able to compete in are levels, so they can also go to national finals. If they are in the competition squad, they are more likely to be coached by level 2, 3 or 4 coaches, whereas in recreational squad they are more likely to be coached by level 1 coached by assistant coaches or level 2 coaches. Sponsorship in gymnastics are used, which are Talented Athlete Sponsorship Scheme, which links elite sport to higher education. This is to aim to reduce the numbers of talented athletes who drop out of sport. British Gymnastics have to nominate performers which are eligible to get this sponsorship. Another sponsorship is Sports Aid, which is eligible for gymnasts between 11 and 16 years old. They have to be the top 5 in their discipline, and British Gymnastics has to allocate 20 applicants, which a national coach puts forward. They can receive up to from £250 to £350.
Okay. Could you do any of the health benefits?
Do I talk about doing my last one?